Withdrawal. The withdrawal method is when the male withdraws his penis from the woman's vagina prior to ejaculation. With perfect use, this would result in pregnancies in only 4% of women in a year's time. But with typical use, including those times where withdrawal did not occur in a timely fashion, there is a 22% chance of a woman getting pregnant within the first year. Condoms. There are both male condoms and female condoms. Most are familiar with male condoms. They are usually a latex sheath which is pulled over the penis prior to sexual intercourse. With perfect use, there is a 2% chance of a woman becoming pregnant within the first year, and with typical use, there is an 18% chance of a woman becoming pregnant. Perfect use means keeping the condom on throughout the entire sexual encounter. That's why the typical use has a high rate of failure. The female condom is put in place by the female prior to intercourse, and this has a 5% chance of a woman becoming pregnant in the first year with perfect use, and a 21% chance of pregnancy with typical use. So condoms, as we shall see, are not the most effective way of preventing pregnancy. Spermicides. A spermicide is a barrier method that kills male sperm before it can fertilize the female ovum. Types of spermicides include foams, creams, gels, suppositories, and films which are inserted into the vagina prior to sexual intercourse. If these are perfectly used, that is, if they are inserted according to the directions at the appropriate time, then 18% of women will nevertheless become pregnant within the first year. However, with typical use, 28% of women will become pregnant. So there is a rather high rate of pregnancy under typical use of spermicides. Diaphragm. A diaphragm is a cap that is placed over the woman's cervix, the opening to her uterus. It is a flexible ring that is fitted by a medical doctor. The diaphragm is usually used in combination with spermicide, which is put on the diaphragm before the woman inserts it prior to having sex. With perfect use, following the directions, there is a 6% chance that a woman will become pregnant within the first year, and with typical use, there is a 12% chance. So these barrier methods are only partly effective in that on average, 1 out of 4 or 1 out of 5 women will get pregnant each year. All of the barrier methods we have discussed are contraceptives. Barrier methods don't interfere with ovulation. They prevent the sperm from fertilizing the ovum.